Learn about the new EVD Free Flow, an updated version of the well-known HPbio EVD, with several improvements and new features. Modern design with millimeter mercury marking on one side and centimeter of water on the other. Two-stage barrette. Large hydrophobic antimicrobial filters. Laser system support for zero-point leveling. Secure fixation on the IV pole. Quick release dome. Possibility of drainage with negative pressure. Catheters available in neonatal, infant, and adult sizes, in addition to a specific option for hemorrhagic cases. Drainage system installing setup. After placing the catheter in the ventricle, insert the connection protector and connect the lure connector with the screw-on closure cap. Connect a syringe with saline solution to the female lure and fill the drain tube until the barrette starts to drip. Removing the air from the system will facilitate the beginning of drainage. Remove the female lure and connector cap and connect the catheter to the system. Reinforce the catheter connection by making a tie with surgical thread around the connection shield. System fixation setup. Unfold the fixation bracket and attach it into the IV pole at the desired height. Screw it until the system is securely locked. System leveling setup. Attach the laser pointer to the support located behind the three-way stopcock to direct the laser beam towards the patient. It is possible to place the pointer in both directions. With the help of the level tool, keep the system leveled and point the laser beam at the patient's head. Lightly unscrew the bracket and adjust the height of the system so that the laser lines up with the patient's ear canal. After the adjustment, screw the bracket for correct fixation. Remove the laser pointer. Step by step for pressure adjustment. Release the barrette screw and adjust to the desired drainage pressure, with 13 centimeters of water being the pressure normally used. Tighten the screw to secure the position and make sure that the liquor is draining following the drip inside the barrette. Step by step for measuring the drainage volume by time. Turn off the barrette one-way stopcock and start counting time with the 8 of a clock. The barrette's first stage is ideal for measuring pediatric patients who produce less CSF volume. When the measurement is complete, open the barrette one-way stopcock for the liquor to be drained into the collection bag. Step by step for bag emptying or bag exchange. Close the bag's hydrophobic filter clamp. Asepsis the collection port with 70% alcohol and use a 60 milliliter needleless syringe into the collection port of the bag. The clamp above the connection must remain open. Dispense the content of the syringe and repeat the step until the bag is completely empty. Open the bag filter clamp. As an alternative, the bag can be exchanged. In that case, close the tap, disconnect the lure connector, and remove the bag from the holder. Place the new bag, close the lure connector, and open the tap. System handling warnings to avoid contamination and drainage obstruction. To collect CSF and administer medication, always use the Y valve. Abscesses the collection port and connect a syringe. Never use a syringe with a needle to access the port. The use of a needle can lead to leakage and contamination. Always avoid laying the system down so as not to get the barrette and bag filters wet. Wetting the filters can clog them, compromising drainage. But if it is necessary to temporarily place the system horizontally, close the bag filter clamp to protect the filter and open it again when the system is upright. When returning the system to the vertical position, if a CSF lack of flow from the barrette into the bag is observed, simply pump the chamber dome with your finger to immediately unclog the filter and empty the barrette. Wetting the filter can interrupt the air entry into the burette, stopping the liquor flow from the burette into the collection bag. Filter wetting can also occur if the burette is filled beyond its capacity, as a result of the burette tap remaining closed for an inappropriate time, or the bag not being emptied when it is fully filled. Pump the dome to resume drainage. Avoid lifting the collection bag and placing it in a horizontal position during the emptying procedure to avoid wetting the filter. As a preventive measure, always close the filter clamp during the emptying procedure. The system can also be fixed by the cord to the infusion pole as an alternative to fixing by the fixture support. The children's and pediatric models come with a sticker to be fixed on top of the system in order to make the environment more welcoming and pleasant. Simply peel off the film and place it over HPbio's logo.